The potential complications from dermabrasion, chemical peels, and laser resurfacing are very much the same. Often after these procedures, small white pinhead-sized bumps can appear on the surface of the skin. These are milia, which are small cysts formed from blockage of small openings in the skin. They usually appear the first few weeks after treatment and clear up by themselves without treatment. Sometimes they have to be opened like a blackhead and drained. Prolonged redness may last up to a year, although that is very rare. This time frame is based mainly on several variables. These include the depth of your treatment needed, which is largely based on the depth of your problem. Sometimes a patient with prolonged redness might have had a very aggressive and deep treatment. Certain people with overly sensitive skin may also have prolonged redness, as well as those patients receiving sun exposure too quickly after the procedure. The average phase of redness probably ranges from 3 weeks to 3 months. Makeup usually easily conceals the redness until it fades away. Men typically have a more difficult time with the idea of applying makeup. This is a reason for them to more carefully evaluate this procedure for their unique needs. Here is an example of a patient before a laser resurfacing around the eyes on the top, and 1 week after a light resurfacing in the photo on the left. She had a minimal amount of wrinkling issues and wanted just a little tightening, so the laser treatment was quite conservative. This is a typical amount of redness with this type of treatment at 1 week. It is usually concealable with makeup by 10 days. The photo on the bottom right was taken 2 months after the treatment. A change in skin color was not apparent with this superficial treatment. Here is the same patient front view after laser resurfacing. The preoperative photo on the top reveals slight wrinkling under the eyes as shown by the arrow. The bottom photo was taken at 3 weeks and shows improvement of those wrinkles. This photo taken at 2 months after the procedure shows sustained improvement as well. This gives an idea of the amount of redness with a very conservative laser resurfacing treatment.
These are before photos of a patient who had an aggressive CO2 laser resurfacing procedure. She was interested in improving the quality of her skin, particularly with the wrinkles in the forehead and around the eyes, as well as texture problems. It is important to know that a facelift, brow lift, or removal of eyelid skin is not designed to correct these skin issues. These photos were taken 2 days after her resurfacing. Note that her face is very swollen and is covered with protective ointment. Additionally, there is fluid associated with the trauma and healing that weeps from the skin during the healing process. Usually at this stage, patients experience a stinging sensation in their skin, which is controlled with medication. Some doctors prefer ointment over the resurfaced area, while others prefer various dressings. This photo shows her 3 days after the procedure to give you an idea of how you might look during the week following your laser resurfacing, so you can better anticipate your recovery appearance and needs. Of course, the appearance and healing period vary among patients, especially with how aggressive the laser resurfacing procedure is. This patient is healing normally and should do very well, although many patients at this stage are anxious that there may be something wrong. Here are photos the patient took at home at 1 week, 2 weeks, and 3 weeks after surgery to give you an idea what you may look like at this stage. Patients typically are wearing makeup at this point as they stop applying the ointment. Without makeup, the skin is typically still red and shiny but very smooth. Some of the improvement that the patient sees at this stage is secondary to swelling. These are photos taken approximately 2 months after her laser surgery. Patients at this stage are usually comfortable with and without their makeup, although again this varies with the sensitivity of their skin and the depth of the resurfacing, among other things. She is not wearing makeup in these photos, and you can still see some areas of redness. Patients should continue to avoid sun exposure at this stage and follow their doctor's orders carefully regarding skin care. Here are comparison before and 2 month after photos of this patient's face. You can see the difference the laser resurfacing has made on the texture and wrinkles of her skin, particularly around the eyes. In these comparison close-up photos of the forehead and eyes, the improvement is easier to appreciate. The skin has not completely healed and will soften over time. It is important to note that many of the wrinkles seen pre-laser will return as the skin continues to relax and the patient continues to animate again.
One of the more common complications or recognized effects from these procedures is a change in pigmentation of your skin in the areas that are treated. Here is an example of a permanent demarcation line of pigment change. You can easily see the abrupt change in the color of the skin from a previous deep laser resurfacing. It must be emphasized that this type of permanent color change can occur frequently with deeper level peels or laser resurfacing. Darker skin patients are particularly susceptible. Because of this risk, generally, areas are treated where the boundaries of the treated areas coincide with anatomic boundaries of your face. For instance, a treatment boundary might include the cheeks to just below the jawline of the face, or in between the nasolabial folds of the face around the mouth or around the eyes. The pigmentation changes can create demarcation or border lines between treated and untreated skin. By treating within these boundaries, a permanent skin color change, if it occurs, would be easier to conceal.
It is very important to have your skin color and type professionally evaluated and to follow pre-treatment and post-treatment instructions carefully. Again, patients with darker skin types have substantially higher risks of encountering pigmentation problems after procedures. Latin Americans, Asians, Indians, and African Americans respond differently and should be much more cautious. Severe permanent color changes may force a person to wear makeup at all times.